Help! I've fallen and I can't get up. Is there any medical professional that can help me? Hi, I'm Madison Omiatek. I may not be able to help that girl, but I can tell you about someone who will help her.
After being sick week after week this year, I thought for my career exploration project, why not do a nurse? I had already spent so much time in a doctor's office and talking to nurses about my own health. Now it's their turn to be in the hot seat, and I get to learn what it takes to be a nurse. The education path for an aspiring RN nurse consists of attending a 4-year college or university in order to earn a Bachelor's of Science in Nursing, otherwise known as a BSN. If you're already an RN, you can enroll in an RN to BSN program, which is geared specifically for RNs who have an associate's degree or nursing diploma. This path usually takes about 2 to 3 years. Nurses have a very hands-on job and a wide set of skills they have to perform on a daily basis. A nurse has to be very good at multitasking. Oftentimes, they're dealing with 4 to 5 patients at a time. You have to be very social and interactive with your colleagues, patients, and their families. Communication is one of the most important skills to have as a nurse. Saying the wrong thing could alter the visit of the patient, what medication they are receiving, or give them incorrect results. You also have to be able to deliver diagnostics and important news properly. Knowing when you're crossing a line and need to stop talking is important. Some of the tasks nurses are in charge of in the office include drawing blood, checking temperatures, blood sugars, and other small tests. Some of the hardest things about being a nurse are the long, physical, demanding hours, and sometimes the stubborn patience that comes with the job. There are 2 types of really hard patients to work with: a non-compliant patient who doesn't listen to directions or take their medications, and the psych patients who can be dangerous to themselves but others at the same time. Working at a hospital is very fast-paced. You are constantly on your feet, moving from one room to another. It can be noisy at times, there are lots of phones ringing at the same time, and call bells going off for different things. At the end of the day, being able to help other people and knowing that they are positively contributing to society is what drives nurses to choose this career path, and it is what is most rewarding to them. Throughout my interview, I learned that being a nurse is not as easy as I thought. It is a lot more technical than taking temperatures and assisting patients as they wait for their doctor. Being a nurse is very physically demanding and tiring, and it takes hard work and dedication to get to the point of success. I personally do not believe that pursuing a career in nursing would be the right path for me. I would have a hard time dealing with the long hours and not enjoy the frantic work environment. Thank you for your time today, and I hope you learned a little bit more about what it takes to